I'm Karen Sealey, a public health specialist in Trinidad and Tobago. I have been an international health consultant with the Pan American Health Organization for 27 years, but I've been involved deeply with the NCD issue since 1993. Non-communicable diseases have been responsible for mortality in the Caribbean since we control the communicable diseases. Unfortunately, we also have very high levels of obesity. The latest survey showed more than 55% of the population between the ages of 15 and 64 were overweight and obese. Childhood obesity for the age group 5 to 18 years increased for some 104%, from 11% of the childhood population to 23% of the childhood population. The major factors that affected the increase or growth in obesity in the Caribbean was the fact that there was changes in the diets of the populations, as well as changes in the levels of physical activity. As we got more schools in Trinidad and Tobago, which is a good thing, they didn't all have the facilities, in fact, for physical activity. And the government has worked really hard on improving that situation, especially in the last 10 years. With respect to the diet, the Caribbean population has become dependent on imported food. People don't eat for nutrition, as I've often had to tell the doctors. We eat for different reasons and we need help with that. We have been seeking to approve the need for front of package labeling so that the action of making the choice as to whether you purchase a healthy product or an unhealthy product is made much easier. Our major challenge there is the influence of the private sector and the interference by the manufacturers of food on the government's decisions with respect to needing those kinds of labelings. Our population is getting definitely much more educated about what is necessary for being healthy. We really need to find a way to hold the governments responsible, accountable, at not just the national level, but the sub-regional level and the international level. The challenge for now as we go forward in the system is to get the government to do the additional policies that are required. Taxation on unhealthy food products. We know it works. We know, for example, in Mexico, the consumption of sugar beverages has decreased substantially. We can't afford to wait. If we have a solution, we really must encourage and urge the government sector. So that's the call to action for me. Identify the policies based on the best buys of WHO that are missing in our campaign and emphasize those over the next 4 to 5 years. Seeking collaboration between academic sector and civil society organizations to increase, in fact, the capacity of civil society organizations to be able to participate in the policy making as well as to hold the government accountable to the objectives that they have set.